Okay, brilliant. So I think this is the right time to get started. Hello, everyone. My name's Jasneet. This is our third MHCBS webinar, and this one is especially special because it's being presented by Amrin Kerry. So Amrin is an approved mental health professional and a qualified best interest assessor. She has 20 plus years of frontline experience across adult social care and mental health services. She's worked nationally across safeguarding, hospital discharge, community mental health, and learning disability teams. And she's also a practice educator committed to mentoring, knowledge sharing, and professional development. So without further ado, here's Amrin Kerry.
Hi, good afternoon, everybody. Thank you for attending today. Just to let you know before we start, there's going to be a quick poll that's going to pop up. If you can just complete the poll, that will be great. In the meantime, I will explain to you, thank you, Jasneet, for the great introduction. What we're going to be doing today is we're going to go through a short PowerPoint presentation. And the main focus is going to be around the questions and answers opportunity at the end. So what I'll do is today, just to make sure you're all here for the right presentation webinar, it's about the mental health crisis breathing space and the perspective of an approved mental health professional. So if we can move on to the next slide, that would be great. Okay. Just to kind of just give you a quick introduction about the mental health crisis breathing space, I'm presuming the previous attendances, you're probably already quite familiar with it, so I'm just going to quickly go through it briefly. So it's for people who are in mental health crisis treatment and in debt problem, and it offers them a temporary respite from the debt enforcement services. It lasts for the period of the crisis mental health treatment, and then it also adds, once we've got the end date, an additional 30 days. An approved mental health professional, AMP in short, is required as stated in the regulations to certify that the person is in receipt of the mental health crisis treatment team to ensure that they qualify and they're eligible. An AMP can also refer for the service. So an AMP can do a referral for the mental health crisis breathing space. But that's usually if you're going to be a part of their crisis treatment journey, because you will constantly get reminders, prompts, and updates on whether they're still receiving it. So that's why we usually it usually is the nominated point of contact that is also the person that's actually a part of the journey. So what I'm going to be looking at now is the regulations. So the regulations are the main body of the requirement that we have to kind of follow. But what I'll be looking at is from the AMP's perspective and how it is applicable for us in our duties. So the debt respite scheme regulation outlines the general framework. Part 1 kind of looks at the key definitions, who the professionals are, their roles and responsibilities, who so what professional bodies they're accredited with as well. So say, for example, it looks at all the services and the creditors and what the eligibility criteria is for debts and debtors to receive in the moratorium. It also explains the legal effects, the restrictions for the creditors and extension deadlines, limitation periods, the review process, and also the information sharing requirements. So that's part 1. If we move on to the next slide, please. Great, thank you. So part 2 of the regulation, from the AMP's perspective, looks at the breathing space. It looks at what crisis mental health services looks like within the community, and also it also makes reference to the specialist mental health services within the mental health team, either in the community or also as inpatients. So the generic, the main crisis services that we look at from the AMP's perspective is either the crisis home treatment team, either the mental health community teams, either they are the liaison teams, or the community mental health teams. So there are also specialist forensic services, and that's why it kind of covers the liaison mental health team, to offer that the room for those teams and the opportunities, and any other mental health specialist crisis services. Just to make you aware from the AMP's perspective, when we are looking at these referrals, to consider your role as the AMP and the consideration stage of section 13, and following that principle. So if you do come across specialist mental health services, which I have dealt with quite a few queries from local AMPs who have been in contact with me about the specialist mental health services, it's about at your discretion, and whether it is crisis mental health and it's a short-term crisis service, or whether they're receiving long-term mental health services. And that's the differentiative where you've got to look at when you are making a decision of what the specialist mental health crisis service is, which is a lot of it's a bit of a grey area at the moment. I am proposing some ideas for them to be looked at, and the regulations and terminologies. But at the moment, I think the biggest issue that AMPs are facing is the specialist mental health service criteria. And again, that is at the AMP's discretion, and you are the ultimate decision maker. So if you feel that that is crisis mental health, and you recorded a clear rationale to your decision making, then you can authorise it on that basis. If we can go to next slide. Thank you. So part 3 of the regulation is about the debt respite scheme administration. So this part really focuses on the Secretary of State's responsibilities, the duties that they have to uphold, and to kind of, from the AMP's perspective, it kind of gives us the formalities of the mental health crisis breathing space, and also that it is a regulatory statutory service that we are offering to the people. So this part of the regulation, it kind of looks at how the information is contained, what the electronic systems are, what information creditors are entitled to have access to or not have access to. It kind of gives you the overview of the register, what information is recorded. That's why it's really, really important, when looking at the administration side of it. When AMPs, when you do get the referral come to you and it's at the authorisation stage, to please just make sure you've got all the correct details, such as trivial as it sounds, the person's name, date of birth, address, and also do your checks as well, taking into consideration the section 13 again from the AMP's principle under the Act, that even checking the nominated point of contact, that the form is correctly recorded, the professionals have actually recorded this, and it isn't actually the person who's in debt making the referral, and just making sure all those details are correct, because they are the details that will be inputted on the register, and then the Treasury have access to when it is on the register, when the referral has been accepted and processed. So it's really important to take that into consideration when you are doing your checks, not only about whether they're receiving crisis mental health treatment, whichever form, either as an inpatient or in community, but also that the nominated point of contact and all the details are correct, because you are accountable for all that when you are doing your authorisation process. Next slide, please. So also in this stage, as I touched, the Secretary of State, have got a role with this register, and the delete information concerning this 15 months after the date has lapsed. Also, the register is maintained by the Secretary of State, so it must have, like I said, all the correct details. And I'm emphasising on this. I mean, yes, it is down to the nominated point of contact who gains consent with the persons who's in debt, and they gather all the information from them. But again, there's that, because you're the ultimate authorizers, you also need to make sure that information is correct. I'm not talking about the creditors and all the debts. It's all about the personal details, even the professional that's involved, that they're contactable, that they're going to be involved, all these basic checks, because they're the ones that are going to get all the notifications if the referral is accepted and they are on the mental health crisis breathing space. They're going to get all the prompts from the emails, notifications through the portal to check if they're still receiving crisis mental health treatment, whichever form, inpatient or community. Finally, the debt advice provider sends all the notifications to the Secretary of State as well through the electronic system. So again, that's why it's really important to make sure we've got all the correct details and personal details for the person who is in debt, but also the nominated point of contact. Next slide, please. This regulation, so part 4, it's more around the supplemental side of it. So it really focuses around the quality assurance, the reviewing and the monitoring responsibilities. As we are all aware, our work is always constantly quality assured. We're constantly looking for areas for development. We're also looking for progression, regression, any ways to kind of like make any changes. So this report, so we are coming up this year actually for the first report to be published before May. So that is looking at the whole mental health crisis, the work we've done, the whole quality assurance and monitoring side of it, whether it's effective or not. So this report is done every 5 years. It also this section also covers the kind of some of the side legalities of Small Businesses Employment Act, why the report is published and under what regulation. It also sets out the objectives, the achievements of the provision, the objectives that have been achieved. It'll look at what objectives that remain appropriate, what don't remain appropriate. I'm also going to be looking at, so based on this webinar today, we welcome a lot of feedback. So we did a conference last week, and Rebecca talked about expert by experiences as well, which can be either the people who are in debt and through the referral process, but also the AMPs and professionals involved in the referral process as well. We welcome all the feedback from yourself so we can actually implement in the quality assurance side of it, but also for me to explore terminologies and regulations, any kind of wordings or any changes that need to be made, or any formal guidance or any formal kind of e-learning that we can look into. So it's really important this stage, this part where we gather as much information we can from yourselves. Moving on, sorry, the next slide, please. So from the previous webinars and from the events that we've been attending, we have had a lot of queries, a lot of questions about the case law K versus Lees, and a lot of AMPs that we've had conversations with, including myself, through these formal events and through general advice queries when looking at referrals and questioning some of the crisis treatment. They have been quite I think because of this case law, I think it's kind of hindered a lot of referrals, and it's caused a bit of anxiety within the AMP services and teams about making referrals. So just to kind of touch on this was the main case law. And this is from the AMP and nominated point of contact's perspective, and it's just a summary. So there is more information that we can provide if you want. So just to kind of let you know, after this webinar, we will circulate the PowerPoint, and we will also circulate the regulations and the guidance. So you've got access to that from a knowledge base. And also, if you are unsure of anything, or if you did want to look at the parts in more detail, all that's going to be in there. So this case law It's all about making sure all the relevant checks have been completed and that the debtor is actually in receipt of mental health crisis services, and either that's in the community or as an inpatient. So the main point for this from our perspective is that it's about providing clarity for the debt advisors and the AMPs, and making sure that we're emphasising on the importance of the rigorous adherence of the debt respite scheme regulations, but it's also making sure that the scheme works as it's intended for the vulnerable individual that's in that mental health crisis at that period of time. So ensuring that we do that is making sure we've got all the right information when you're having that first onset conversation with the person and completing the referral. So because obviously it's going to be a distressing journey for them whilst they're going through their crisis mental health treatment, however form that is, either in the community or as an inpatient, that the more information we can gauge from the beginning, the more we're able to support them with the debt respite as well. So what the AMP actually needs to know from this actual case law is that the mental health crisis breathing space actually protects people who are in mental health crises from the debt enforcers. You know, it can last for however long the crisis period is. So as long as they're receiving that crisis treatment, however long that period is, either in the community or as an inpatient, there will be constant notifications to the nominated point of contact for them to notify them when this ends. When that ends, they will also get an additional 30 days as a cooling off period before, you know, they start getting reinstated. And in that cooling off period, they get a lot of debt advice from external financial services as well, and debt relief services. So that you know, there's a lot of support in that period that they need to benefit from. But it's really, really important that you record, you know, a nominated point of contact or the AMP, who's going to be able to, because you know, the AMP services and nominated point of contacts, you know, sometimes they're off on sick, sometimes they're on leave, you know, they're not always going to be available. So it's always good practice to put a secondary point of contact down if possible, or if you've got a team or duty inbox. So I know in quite a few local authorities, they have an AMP team duty inbox, and also like community mental health nurses, duty teams have a duty inbox. Pop that in as well. So if the nominated person isn't available, then they can contact that. They can contact an alternative through that inbox. In regards to the case versus Lees, continuing with what it means for AMPs, it's also about people who experience the mental health crisis, and whilst they're in that recovery and stability stage, that, you know, the courts also addressed that there weren't that there was misuse of exceptional cases and not routine AMP decisions. So there's no personal liability for the AMPs. That, you know, the decision that you make in regards to whether the person is eligible or not roots back down to the section 7, the section 13 consideration stage again, because that's the stage when we're considering when it's a mental health assessment and exploring all the least restrictive options and all the information that you've got. And that's the principle to apply when you're going through your authorization stage here, because you know, your decision whether the person is eligible or not is in good faith. It's within your professional judgment, and it's in line with the guidance as well. So you know, and the reason why it's an AMP that makes the authorising decision is because you're specialists, you're trained, you are you know, there's a specific section under the Mental Health Act where you do the consideration stage when considering a mental health act assessment, and that principle is the same principle when you're doing your authorisation stage as well, for mental health crisis breathing space. So yep, just moving to this. Oh, so that's the end of this PowerPoint. So I think the PowerPoint is very direct, because from the previous webinars that we've had, It's more, we've had a lot of AMPs and a lot of professionals with loads of questions, and I think we've never really had the amount of time to kind of cover all those questions and answers. So the main focus now is we're at the question and answer stage, and this is where we're going to look at, I'm sure there's going to be loads of questions and loads of queries, so we're going to try our best to try and answer as much as we can. If we're unable to cover all of them now, there will be an opportunity afterwards. We will be looking at some drop-in services, and we will also try and respond to the questions within the chat inbox as well afterwards. So this is a stage where Rebecca and Raluca will be joining me to support me with any questions and answers that you may have.
Hey, thanks for that presentation, Amrin. I'll just be leading the Q&A and delegating the questions for some hopefully helpful answers for you all. So Amrin, we've got one from Michael, which is quite interesting. So he at the moment is unable to complete an MHCBS application as the patient has no care coordinator. How does Michael go about the application in that sense?
So hi Michael, thank you for your question. So in response to that question, if they're receiving crisis mental health treatment, either in the community or in a patient, they will have a nominated professional. So for example, if it's crisis treatment in the community, they're open to the crisis home treatment team or the equivalent. So it will be anybody who's on duty or whoever's working with them there. If they're an inpatient, then it'll be one of the ward staffs, one of the nurses or their key workers or whoever it is on the ward that is on the list of the nominated point of contacts, list of professionals that can complete the form. I hope that's answered your question, Michael.
Thanks for that, Amrin. We've got another question as well for you. So this one's from Erica, and she's asked, how do we get hold of an appropriate AMP to confirm or sign the referral?
So this is a very recurrent question that constantly is asked to us, and we have been asked the same question in the previous webinars. Every local authority, which is a statutory requirement, must provide an AMP 24 hours, 7 days a week. So every local authority has an AMP service or an AMP team. So if you're unsure, if they're open to community crisis mental health teams, they will know who the local AMP service is. If not, you can go through your local adult social care customer service telephone number, and then they will put you through to your local AMP service.
Okay, thanks for that, Amrin. I have another question, potentially for Rebecca. This one's from Richard, and he's posed a scenario that if an MHCBS comes to an end, is it automatically reinstated, or does the entire process have to be redone? He's had a case where a staff member was unable to confirm the monthly confirmation due to sick leave, and the service user was discharged. So if you could talk a little bit about that, Rebecca, that would be great.
Yeah, absolutely. So this is why it's so important potentially to provide us with that secondary address. So unfortunately, underneath the regulations, if we don't receive that confirmation from the nominated point of contact within that 20 to 30-day period, then automatically under the regulations, we have to close the moratorium. And the protections around it close with immediate effect because it would have been 30 days from the previous confirmation that they were receiving crisis treatment. What that means is the individual would have to complete a new application. So essentially, they would need to have a new form submitted. It's unfortunately just one of those things that is written into the regulations. Currently, there is no way around this for us as providing the service. It is dictated by the regulation. So appreciate it happens, and it happens a lot. It causes challenges for everybody involved, but we do have to follow the regulations to the letter on this, unfortunately.
Hey, thank you, Rebecca. I've been told that somebody does have their hand up to ask a question for quite some time, so I'm not sure if you're able to enable your mic, and feel free to ask the question verbally if possible. If not, please get it in the comments or in the chat, and then we'll do our best to get round to it. We will be extending to 12:45 today to answer questions. I'll give it a couple of seconds. No, sorry if you're having trouble enabling the mic, but please get your question in the chat. We'll move on to a question for Raluca, if that's okay. Oh, okay, brilliant.
Yeah.
Great to hear from you.
Yeah, it's just this mental health crisis, and I know there's case law, but I feel it's quite subjective, and what one AMP might see as a mental health crisis, another AMP might not. And I'm just thinking a lot of our referrals are coming from the MINT teams, where someone's, that opens a secondary mental health services. And if they weren't under that team and, to monitor them and, make sure they take their medication, whatever it is, then, they would relapse. So is that indicative of a mental health crisis, that someone's open to one of those teams and having a fair amount of input?
Hello, hi.
Hi, sorry.
Hi, thank you for your question. So I think in this situation, it is at the AMP's discretion, and this is why I've said it's really important for it's all about when a referral for a mental health act assessment comes to the AMP service and we look at the Section 13 consideration process, it's all about whether this crisis mental health is a long-term crisis management or whether it's a short-term crisis management, and it's the risk factors. So say if they're at high risk of an imminent admission, or the risks are escalating and you can no longer safely treat them in the community, then that will be classed as crisis treatment. But if it's ongoing and the relapse and the medication, and it's a long-term care and treatment plan, then it wouldn't be considered as crisis treatment. And that's where it's down to the AMP's decision, and they need to kind of make that definitive decision whether it's long-term crisis or short-term crisis.
Sorry,
I've answered that for you.
If it's a long-term, sort of maintenance, then that wouldn't be seen as a mental health crisis.
No.
Okay.
So it's applicable to people who are in crisis mental health, and sometimes, if you're ever unsure, you can liaise with your crisis home treatment team, because we've got there's this label of the specialist mental health services in the community, which there are quite a different levels of services in the community. If you're ever in doubt or ever unsure, lean on your local. If they're not open to the crisis home treatment team, lean on them and ask them to do a review or consideration of whether this is crisis mental health treatment or long term.
Okay. Yeah. Okay. Thank you.
No problem. Thank you.
I think we've got another hand up as well for another question, so feel free to verbally ask your question as well. Give it a few more seconds. I can see something happening with the mic coming on and off, but maybe not.
Hi, my name's Elaine.
Oh, sorry, we've caught your name, Elaine, but we can't hear the rest of your question. If you potentially press the button again, maybe. Oh, maybe some technical difficulties. So sorry. Oh, there we go, Elaine.
Thank you. So I'm not sure what happened there.
No worries.
Just checking you can. Okay, I've got some concerns regarding the previous advice she's given about ringing the crisis team. I'm a crisis team manager in West Midlands, and I don't think that's quite the correct advice here. So the people that can apply for breathing space, as per the presentation we've had today, obviously it's when a patient is in crisis. So it is liaison psychiatry, CRHT, inpatients, and then you've also said it would be some specialist teams in the community mental health team. So it wouldn't be your generic community mental health team. Now, we wouldn't then know what constitutes a specialist team within a community mental health team. That's not our core business. So we would be expecting that team to know, do they fit under that remit or not? And then following that to follow local processes. So we've been working with breathing space for years now. It's an established process. If we identify that somebody who is in crisis, that that we've assessed them and accepted them onto caseload, then we would then make an application with the appropriate information, and we just send that on to our AMP colleagues. So that's it's a very simple, we collect the information, identify the need, we contact our AMP colleague, they make the application, and then the local organisation that is managing breathing space will then make contact with us and maintain contact directly with us. So it is very simple. Once you kind of get used to it, it's easy to do, and you need to have a nominated contact person like within the team. But I would just raise concern about ringing crisis teams to ask them, because we wouldn't know in Wolverhampton, for example, where I am, if somebody from my community mental health team rang me up and whether they should request a breathing space, I wouldn't know if their service fit the remit or not.
Thank you, Elaine. Thank you. My apologies for the misinterpretation of that advice. So I'm not saying phone crisis mental health services. What I was trying to explain was that if somebody is in crisis mental health services, and so there's some local authorities that have partner crisis services that work in alignment with the crisis home treatment team. So like, because you're doing that partnership working, you can liaise with each other if you have got that option. But I'm not suggesting be calling the crisis treatment lines and stuff like that. Usually if somebody is in crisis mental health, they'll already be open to crisis home treatment services. So that's the kind of advice that I was kind of offering, to lean on them if they're involved or not.
Yeah,
Sorry.
I think the person was asking, how do they in a planned care service make a referral? And I think there's limitations for a planned care service to make a referral. So it's only very limited specialist services, and you referenced one being forensic. Now, I wasn't aware until today that anyone in planned care could, so that's information for myself. But for anybody here that does work in planned care, it's recognising that there are limitations to the referrals that you can make, because it is very much an urgent care service provision.
Yes. Yes.
Thank you.
No, that's fine. Thank you.
Okay, so we've got about 10 minutes before, unfortunately, we have to close this session. I just want to reiterate as well that due to the success of these webinars and the amount of questions we are receiving, we will be doing these webinars on a monthly basis. So if you don't get your questions answered in the next 10 minutes, please do pop on by to one of our monthly webinars, which you'll be notified about very soon. And again, email us as well, if you have any queries or questions, because we obviously want to do our best to support you and your patients. I think there is somebody else with their hand up, so please go ahead and share your question, and then we'll get someone to answer it for you.
Can you hear me?
Okay.
Can you hear me?
We can hear you faintly. I'm not sure if your settings need to be adjusted. I'm ever so sorry. I'm not sure of your name.
I'm joining with Salome's computer, but my name is Esther Gelone. Can you hear me now?
Yes, we can hear you faintly. If you could try your hardest to shout at us potentially.
That's fine. So my question is, I work in forensic inpatient, and I have two individuals who are currently on your scheme. And I just wanted to confirm, because I probably have missed in and out of the conversation today. They're still receiving mental health treatment, obviously, because they're inpatient. And so can I still term them to be in crisis and continue to renew their application with you?
Hello, hi. So in relation to that, it's whether they're still receiving that crisis mental health treatment. So if they're on a stabilised long-term care and treatment plan, then it's ultimately down to that professional to make that decision whether it's still crisis or whether it's a long-term care and treatment plan. But if it's still crisis, you can still keep notifying us that they still need to remain on the mental health crisis breathing space.
Okay. All right. Thank you. Thank you.
No problem. Thank you for your question.
We have got a fair few questions to work through. So I've got one for Raluca here. It's from Sally, and she's asked, what debt support do people get once in the MHCBS? Some people she has referred have provided feedback that they perhaps weren't offered the debt support that they needed. If you could just shed some light on what provisions are and resources are available, that would be great, Raluca.
Thank you. So yes, we work with a debt provider called Toynbee Hall, and they are located in London. And the type of debt advice that they provide is mainly over the telephone, but they can also offer digital support through emails. There is advice that can be given at the beginning of the entering the client in the scheme if there are any urgent situations, any emergencies or any debts that cannot be included. And once the client is approaching that kind of end of the crisis treatment and they feel well enough to receive full support, then full debt advice is offered, which includes a telephone appointment where a budget is created, advice is given on the enforcement action for each of their debts, and then options to deal with their whole indebtedness. And also they can be supported with implementing that particular debt option. And we are aware that in past there have been some issues with potentially not having enough resources or at the right time to offer to these clients, but we have now sorted those out, and we have a full team that is ready to support these people to the best of their abilities. Thank you.
Great, thanks, Raluca. I actually have a follow-up question for you, Raluca. This is by Alice. I think she's asked the question a couple of times in the chat. Alice has said that she's referred a person whose bank account became frozen. Can this be caused by the MHCBS?
I'm actually answering that now in writing, but thank you. Yes, so it is possible. It depends on the bank's internal policies. So one of the rules of the mental health crisis breathing space is that all eligible debts need to be included. So the debt advice provider or the client neither can pick and choose. So we run credit reference reports, 2 of them for each client. And if overdrafts or credit cards or personal loans linked to that client's bank account appear, we will have to list those creditors into the insolvency service portal. So that can trigger the account to be frozen in rare cases. However, what we do in the client entry letter, we provide advice on opening a safe bank account. I know it can be tricky in some situations for these patients, but that is the route. So there's always an alternative where they can open a bank account with no connected debt and move all their income into that, so it becomes protected. Thank you.
Brilliant, thank you, Raluca. We've also got a question from Saidu. I think this one's for you, Amrin. They've asked, is an AMP the right professional to do this when they usually have limited involvement or short intervention with the patient?
So that is a very open question. However, legally, under the regulations, the AMP is the authoriser that's been recorded under regulations. So practice-wise, that can be questionable by the professions. However, under the regulations, it's a requirement that it has to be an AMP. And the reason why it is the AMP is because that they're highly qualified and trained in mental health profession. They also undertake a lot of mental health act assessments. They also have the AMP standards and the least restrictive approaches, but they also have that holistic principle of, you know, gathering all the correct information and the research, and therefore when they are doing the checks to make sure you know, you've got all the right details, that, you know, it's the AMP that's the appropriate professional to do so.
Brilliant, thank you, Amrin. We have got a few more minutes before we have to end this session. So I'll just direct another question at you there, Amrin. It follows up on a question you answered about confirmation and from the NAMP and them signing the referral. I think Erica has said, but the individual has to put their first and last name on the referral form. So how do they go about it when they want to put an AMP team's email address? So maybe an email address that's not designated to one individual, but to a team.
So thank you, Erica. So you will need to put a named AMP's details down. When I was talking about the AMP team, it can be a secondary contact detail that you can add. It's just in case that AMP that's been named in the referral is not available. But usually when the nominated point of contact makes the referral, they will be consulting with the AMP and gathering an AMP's contact details, or they usually call the AMP team and find out who the triage or the duty AMP is on the day, and then they tend to pick up the referral. So long as if the appropriate communication's done, then there shouldn't be really any issues.
Okay, great. Thank you for that, Amrin. We do only have 2 more minutes left. Sorry. I don't believe we'll probably be able to answer any more questions in that time, unfortunately. But thank you all so much for sending everything over to us. We will do our best to answer as many as we can as well, especially more kind of urgent scenarios which people have posed in the chat, just because, like I said before, we would like to help you and your patients in the best way that we can get referred on to the MHCBS scheme. So as I mentioned as well, we will be holding monthly webinars due to the immense success of the 3 that we've held. So please keep your inbox open for our notifications of those monthly webinars, and please feel free to join those and ask your questions there also. So yes, thank you once again. Thank you again to Amrin as well for presenting this session, and to the Q&A host that answered your questions. I hope you have a lovely rest of the day, and we hope to see you in our next webinar session.
Thank you, everybody.